Welcome to this Nursing SIG Launch Webinar. What is creative health and how are nurses involved? My name is Alexis. I'm the General Manager for the National Centre for Creative Health, and we are the Secretariat for the new Nursing SIG, and I'll be providing IT support today. So now for the session. Today we are delighted to be joined by Nursing SIG co-leads, Dr. Marion Lynch and Dr. Vicky Ridgway, as well as additional speakers, Laura Atyeo, I hope I said that right, Laura, Dr. Nicola Fisher and Dr. Marie Clancy. I'll let each of them introduce themselves during their part of the agenda, but first I'll hand over to Marion and Vicky to get us started, and I'll let everyone else who isn't ready in. So over to you, Marion and Vicky.
Thank you, Alex, and hello and welcome to everyone to this amazing opportunity that is a dream come true of over 30 years of me being a nurse working in the arts before we defined creative health, and actually trying to ensure that people stay human in a non-human system. So this is a moment for an imaginative, creative space where we're bringing together nurses and artists and community activists to do something that we all know needs to be done. So I'm going to start just with a 2-minute moment. The dilemma we all face, the absent present nurse. We are a profession that's never lacked intelligence, skill or commitment, but quietly losing something more fragile. The presence that we know makes the difference. We're working in systems faster, louder, smarter than ever before, targets humming in the background. And yet, when you ask patients what they remember, you ask nurses why they stay, you ask communities who they trust, they talk of the moments, the pause, the hand, the way that they were seen. And this is the dilemma that we face now with an absent and present nurse. Presence is actually what we're all about. And creative health and the arts matter because they keep us human. And today you're going to hear about that, from how important it is to enable agency through the arts from Laura, how to be person-centred, to recognise ourselves as a subjective element within care, and how to look after ourselves, all through education, and how to say this in a way that enables us as people who are here to help others stay human ourselves. So with that in mind, and an exciting 10-minute section from 4 different people, and then a what's next moment. So please stay and gather your thoughts as we go, put them in the chat and be ready for questions, because we've got all sorts of things planned for 2026. I hand over to Vicky, who's my colleague from the Education Excellence Department, to just say for 10 minutes her work around creative health and define it as well. Vicky, over to you.
Hello and welcome everybody. I'm just going to share my screen. So I'm Professor Vicky Ridgway, and I've been very passionate about creative health since we rewrote the nursing curriculum at the University of Chester. I'm part of a wider team, and many of my team hopefully are on this call today. So I'm just part of one little part of the jigsaw puzzle here at Chester. And we have been running a creative health placement at the University of Chester since 2022. So I'm going to just talk to you a little bit about that, and also then what creative health is, so that just in case anybody's not aware of these concepts. So the images you see in front of you are from the creative health placement, and we've got permission to share them as well. And more excitingly, I think, is that we've worked really hard as a team, and we won the Student Nursing Times Community Placement of the Year for this work. So we've tried and tested, and it's really, really positive. So I'm just going to start with what creative health is, because I didn't know what creative health was, and I hold my hands up that when I had a knock on my office door from someone from what we call the Philip Barker Centre for Creative Learning at the University of Chester, and I was told to read this document. And it was basically about how we needed to put creative health into healthcare professional programmes. So when we rewrote the nursing curriculum, I had to do a lot of bedtime reading, and we actually put in a programme aim. So I had to learn that creative health is defined as creative approaches and activities which have the benefit for health and well-being. And this is really important, because actually we look at statistics, and 1 in 5 GP appointments are for social reasons. We talk about social prescribing, but our nurses don't necessarily understand what that is and what the benefits are. When you look internationally, creative health is recognised from the World Health Organization as well. So it just gives you an idea of where we are. So very briefly, because I've only got 10 minutes, I'm just going to talk to you about what we've done at Chester. So as I said, in 2022, we piloted a creative health placement for 60 nursing students. That's from all 4 fields of nursing. And they did a mixture of immersive simulated learning, where they worked with a range of artists and music and art and dance, as you can see the dance there, activity on the slide, and they learnt the craft. And in the afternoon, they offered out the offer like a pop-up social prescribing offer to members of the public. The students, importantly, also kept a reflective journal during that placement in particular. And what we found from this placement is that it was a transition. They didn't necessarily understand why they needed to do creative health. There was a lot of emphasis on the acquisition of clinical skills, such as doing a blood pressure, rather than the softer skills of communication and reflective practice. But what they appreciated over the journey was that they developed their own well-being, which is really, really key. And we're just reporting on that at the moment. They developed, enhanced their communication skills and their teamwork and their reflective practice. What they also said, and this is really important for the context of this, the rest of this webinar, is that 84% of students now agree that working with creative health answers helped them appreciate how they could use creative health skills within their nursing practice. 94% of our students agree that engagement with social prescribing has increased their knowledge of health and wellbeing interventions, and 94% of them said that they've been able to see how the placement has impacted on the understanding of creative health on an individual's health and well-being. And without further ado, I'm just going to stop sharing my screen and I shall let the next person take over, really, and I'm happy to answer questions at the end. We have had our pilot paper published in Nurse Education today, and I'll put the reference in the chat to help people pick that up.
Thanks ever so much, Vicky. And this building into the nursing curriculum alongside the artificial intelligence kind of work is crucial now. I think the non-human element is in every policy, and we're speaking a lot about that in nursing practice. The human element is now to run in tandem, and you're leading that educationally. And I hope people who are listening will now see that this is possible, not only as a pilot, but integral into education. And as we go through this next year, we're going to start to develop ways and means of enabling educators to do that, a toolkit, examples, some resources. And if you have them already, please start to share them with us, because we definitely don't have the answers. This is a collective special interest group. We're nurses, we're mostly female. We're going to do this as a band of sisters and others together with artists. So thank you, Vicky. Are there any particular questions for Vicky now before we move on to Laura? You can see. No questions. Hello. There's a Maggie from Hampshire. Marvellous. So I'm going to move on to Laura now. Laura and I met in NHS England. Don't hold that against us, because we are both recovering from that experience, but both work in the arts and now have social enterprise organisations. Laura's particular take on working with people in the community and building communities and ensuring that the future of healthcare actually has creativity and the patient voice within it is astounding. And Laura, the image I've got in my head about the over 65s group. So just tell us what you're able to make happen in Shropshire to make sure person-centred and human-centred care actually happens as a musician and as a social enterprise organisation.
Thank you so much, Marion. Hello, everyone. I'm Laura Atyeo, and I'm delighted to talk to you today. I'm going to bring you a tale of great joy, camaraderie, of humanity, hopefully very inspiring. And I want to talk to you about how, through creative means, lives can be transformed in a heartbeat, not in months, not in years, but instantly. and how well-being is not an outcome, but actually the beginning. So I'm founding director of Open Harmony, CIC, that's a social enterprise, which is a business for good. I'm going to talk to you about another social enterprise I run called the commonly known as the Alliance, the Shropshire Thriving Communities Alliance, and give the example that Marion's alluded to. The important thing to know is that we're businesses for good and that we're led by the community we serve. They help make the decisions and help run our organisations and inform everything that we do. My background is in the NHS, God love me, 20 years as a health informatician, which means designing, building, testing new electronic record systems, which is a form of creativity in its own right. I was inspired by a talk on social prescribing, which is essentially about real human connections, real humans helping each other out beyond the pills, beyond the formal therapies. And I wanted to be working directly with people now, away from the machines and working with real human beings. So I put my amateur musical skills to work, and Open Harmony was born in 2019, so we're 6 years old. Open Harmony, the important word is open. We're open to people of all backgrounds, of all abilities. You do not need to be good at music. You do not need to have any particular ability or experience at all. We're all about improving mental well-being, mental and physical well-being through music, or if you want to look at it another way, decreasing or preventing ill health. And we do that through building community. Music is an extremely powerful way of bringing people together. It's a universal language. It speaks to all of us, no matter what language we speak, no matter what our background is. And it helps us to express and articulate things we cannot possibly put into words. Peer-to-peer support is a fundamental part of this, and just being seen and heard and accepted for who you are so that you belong. You don't fit in Open Harmony, you belong, no matter who you are. We help about 100 people a year. Overall, we've helped about 1,200 people, and about 90% plus of the group members say that it's benefited their well-being. I want to talk to you about one of those people, a woman in her 30s called Hannah. She joined a year ago. She was extremely isolated at home. She had not left her home due to her visual impairment. She can hardly see at all. She attended an online group, and then she started coming to an in-person group, one of the in-person groups we run in Telford. And the effect on her, she said, was immediate. And it was that social contact through the Zoom window. So the machines can be helpful sometimes. But through that Zoom window, suddenly she had a room full of people to talk to. And it was the joy of playing with others, playing her guitar with others. She had not played for anyone except her 5-year-old nephew, who gave, variable reviews about her. And what is more connecting than that, than that creative dance of listening, of responding to people through music, which, as I say, is this universal language. So how did that well-being improve straight away? My horrendously arrogant claim I made at the beginning about well-being improving instantly. Well, I think there's two things. Firstly, it's about creativity itself, which is, if you want to put it another way, it's about play. Neuroscience tells us that we make the most neural connections, i.e. learning, when we're playing. Play is a big yes and. So it's like improvisers, yes and, where can this go? So we invite people to, we have djembe drums. This is a small one, most of the big ones are at the venues. To pick up a drum like this, anyone can bang it. To come up with a beat, a lyric, a tune, and it's yes and, where can we go from that? And if you could picture a big circle of people all drumming these drums, which is so accessible, just a simple dun da da dun da dun da dun dun or something, just get that beat going. The camaraderie it builds, it's fun, it gets your mind-body connection going, and the other thing is, it's a great equalising factor as well. Everyone playing the same, myself included as a leader, all are equal. So play is hugely important. And the second thing, and this is even more powerful, I think, is just being present. It's enough of a challenge and enough engaging enough and fun enough that we're here in the present moment. So the painful past, the fearful future just dissolve. They're gone suddenly. There you are with everyone else, and an amazing thing happens. Joy starts to flow in. It's our natural state. If you take nothing away from what I've said, please remember, please experience that joy is our natural state. It's our mind that gets in the way and clutters it up with all sorts of, oh, what about this, what about that, what about what happened, what about what might happen. Joy is our natural state, and when we're joyful, we're more flexible. Suddenly, we're more accepting. That annoying person over there that was doing our head in, suddenly it's okay. You can brush it off. And we're more open as well. We're more open to possibilities. What else can we do? I can do more. So going back to Hannah, with eventually, her mum was like taking her along to our sessions because she lives a couple of bus rides away, but with a bit of help from the guide dogs as well. So again, collaborations between other organisations. With it, not with a dog, they didn't give her a dog because they're in short supply, but they helped her with the practical matters of navigating. She was able to start getting two buses to get to our sessions, and she started leading our sessions as well. So with a bit of coaching from me, she stepped up to be a volunteer, and when I'm on holiday, she actually leads those sessions now. This is the power of what can happen when you see possibilities in people, and you see the humanity and the strengths in people. And as I'm very proud for her to say that she actually made her way to the airport and flew out to Stuttgart a couple of weeks ago and brings back some lovely German Stollen from the German markets, Christmas markets. And she went to see her dad, who she's not seen for decades. So she's a keen baker. She brings in wonderful things as well to our groups. Everyone brings something. Everyone helps run them. Everyone helps contribute to them. They're absolutely magical. They're wonderful. If I had more time, I could tell you about a lot of other people. If you see our website, there's our showcase film. They'll tell you for themselves. So a word about the Alliance then. So this being these deep collaborations and shared resources between small grassroots groups like ours, Open Harmony, in order to make us more sustainable, basically, because it's cold out there. We've got about 75 members, and one of those is the Craft Shed, and run by the marvellous Jackie, one of the most resourceful people I know. There's a bit of research task going on that they've taken on, which is to find a way to express, or find a way to make, researchers want to find out why older people are not accessing the internet, why, it's all about digital inclusion, how can we make websites, the internet, more accessible to older people. And what they're going to do in response is knit a collage, what they see, how they see the web, how they interact with it, how they are going to interact with it more. This is all going to come in this beautiful thing. It's underway. I've not seen the finished product yet. It's still being knitted. But this is another example of how creativity can just open up these new possibilities, open up doors for people, and it brings people together. So in conclusion, it's about seeing possibilities in every person. People come with medical diagnoses. They often weigh quite heavily on them. I've got this, I've got that. I can't do this, I can't do that. But I try to help them to set the conditions right so that they become actually largely irrelevant over time. Authentic relationships are paramount. Being seen, being heard, as Marion alluded to at the beginning, as Vicky's talked about. It's about relationships, about human connection. And I want to give a definition of how I see inclusion and inclusivity. It's not a value, it's not a policy, for heaven's sake. I would say inclusivity is life itself. Exclusivity is death. Imagine a plant cut off from its roots, cut off from water or air. That is how seriously I take inclusion. And it's all about making the conditions conducive to set the right atmosphere for something fun, engaging, and these new possibilities. And having a warm enough atmosphere that people feel safe so that they can be a little bit vulnerable, because growth always happens when we're vulnerable, and they can be joyful. And as I say, when there's joy there, your natural state, there's a million possibilities. You don't have to be defined by your past. So joy, peace, etc., well-being is the beginning, not an outcome. And I think the most important question we can ask ourselves is, how can we use our creativity, our natural creativity, to be more joyful? And I want to say that nurses or anyone can do this. You don't have to be a great artist. I'm a very amateur musician. Creativity is very broad church. What you need is creative leadership. About 80% of it is setting the right atmosphere to do these things. 20% is the activities. And you can kind of bluff your way through those, because if you invite people in, they'll be wanting to share what they can do as well, and it's more about them than you. So if you're at all inspired, have any questions, please get in touch with me. Please email or phone me. I'd be really happy to help people if they wanted to get started, or you just have any questions about how this relates to health or any matter like that. Thank you for listening.
Thank you, Laura. And I can visualise this knitted digital pathway and us trying to take it into NHS England buildings in a camper van going, no, we've got this sorted, and then just seeing us off the premises again. So what we know is that the arts do what policies can't, but absolutely the arts can also inform what policies need to help us as well. So we've got that balance all the time. And joy and inclusion are the words that I haven't seen written in the NHS 10-year plan in a way that you've described them. But for nurses, as we know, setting up a social enterprise organisation, I know of at least 10 nurses who have set up social enterprise organisation using creativity, lung health, this kind of thing. So anyone listening, we're already sorting it. That's what nurses do. We work with others and we get things done in a way that involves the people who need our help and work in partnership with us as well. So thank you, Laura. And I'm going to go on to Nicola now, who is going to take us kind of in the community and kind of in education and kind of in research and absolutely in the history and the creativity of nursing. And it Nicola brings a bridge between, oh God, my voice just gone up. Nicola brings a bridge between what Vicky was saying, what my work, and what Laura embodies in the work that she does. So Nicola, take us to the barn.
Good afternoon, everyone. Yep, I am just going to share my screen. Do not panic. It's a very short slide deck. Can I just check? Can people see the slides at all?
It's just taken a while, Nicola, so hold
Yeah.
on 1 second. It's saying it's starting to screen share, so there we go. I can see it. We can see it now.
You can see it. Marvelous. Does it move is the next question for me. Ah, yes, it does. Okay. Yeah. So hello, everyone. So my name's Nick. I'm a registered nurse and I'm an assistant professor at the University of Nottingham. I actually live in Nottingham University Business School, which may seem like a very strange place for a nurse to be, and certainly one who's talking about creative methods. But I sit in a research centre called the Centre for Health Innovation, Leadership and Learning. I've been in post here since August last year. But before that, I was doing my PhD here as well. So my background is quite eclectic. I think that's generally an appropriate way to say it. So I retrained as a nurse in my mid-20s. I then went into the army as a nursing officer when I qualified and stayed in the military. When I was leaving the military, I went and did a law master's in health law. And it's there where I got a real fascination with big system structures impacting the way that we as professionals work, but also impacts the patients that come into our care and service users, and things like the health inequalities and things like that, the wider system social structures that are impacting. And it gave me a bit of a light bulb, because something when I was working in clinical practice absolutely got under my skin, and it was the real lack of proper post-registration development for nurses. And it annoyed me so much that I turned it into a PhD project and got funding for it through the Economic and Social Research Council. So I ended up going back to Nottingham, which is where I did my nurse training, and I did my PhD looking at the influence of political economy on nurses' post-registration development in the English NHS, because I wanted to understand why this was so problematic, and I came at it from an issue both in terms of patient safety but also staff retention point of view. I do a lot of volunteering in the community. I do a lot of work with kind of rural communities as well. Public health is one of my favourite kind of subsections away from policy and workforce issues. So you can normally find me in public health settings. I'm currently doing some commissioned work for the Office for Health Improvement and Disparities, Department of Health and Social Care, in relation to the role of public health in nursing, midwifery, and nursing associate role. So that's across the professions, not just looking at the specialty as well. I worked in Parliament for 3 months while I was doing my PhD. I was a research fellow with the Health and Social Care Committee, looking at government's commitments to workforce, which was an illuminating and insightful process, but very important. But one of the key things that I very much drew on when I was doing my PhD is how do we communicate out our research to people that don't necessarily have access to journals, and even then behind paywalls? How do we knowledge exchange in a way that people helps get them interested, engaged, and on side, and it spreads the word? So I kept on looking for different ways to communicate research away from just publishing in journals or presenting at academic conferences, because that gives you quite a narrow subset of people too. So I came across, and very fortunately, these two experiences for creative methods have actually both come through the University of Nottingham. But there's been two core ways that I fell into using creative methods in particular to talk about my research. Now, the first one, in 2004, there was a program called New Perspectives, which is where you had to link your research to a piece in an art exhibition in the Lakeside Arts, which is the local art gallery on campus here at Nottingham. And it's a different art exhibition every year. And no matter what it is, you have to choose something from that exhibition and you have to link your research to it. You then have to develop a talk, which is 8 minutes long, and it's a public engagement event, which means that then an evening is hosted where members of the public come and listen as they're kind of guided round the exhibition by a member of staff. And my exhibition at the time was Reimagining the Victorians. And I had to say, looking at that title and relation to my work in health policy, I was initially a little bit like, how on earth am I going to pull this off? But I was really keen to do it because I really wanted something different and I wanted to challenge myself as well. I'd never done anything like this before. And I actually wouldn't necessarily have considered myself a creative person either. But it was brilliant, and it made me think. One of the key things that made me do is think, how do I explain my research simply to people that gets them engaged and on side? You know, this is not an academic audience. This is not even people that's worked in healthcare necessarily. This is just your wider public. So that very much lit the spark for me thinking about creative ways to engage and talk about research using creative methods. Then this year, another opportunity came around to use creative writing to talk about your research. So there was a competition run at the university with somebody called Rulers Wit, who are a small kind of publishing, editing group set up. And in conjunction with the University of Nottingham, there was a challenge set that you had to turn your research into a short story. So 2,500 words long, max. You could use your research in any way in terms of turning it into a short story. And if you got selected, it would be published in an anthology. I'd never done creative writing in my life. I read a lot. I love books, but personally never put pen to paper. So again, I looked at this as a very much a challenge to myself, but also thinking about how do I creatively try and express my research in a very different way through this. And the result was Chronicles from the Academic Frontier, which is the anthology name. And I wrote a short story, which I was very honoured to have accepted, called The Library in the Barn. And what I did is that I turned a lot of my analysis in my PhD to do with nurses post-registration development, and I weaved it into a fictional narrative, and I drew some of my core analyst findings into how that could be replicated in building a library. And that's why it's called Library in the Barn. I'm not the only nurse who's been published in this anthology. There's another nurse, as well as an academic, who's also got a story in this book as well. You can buy it on Amazon. I'll put the link. I don't get anything from this, by the way, as sad as that would be. I don't get any tips or anything from this, but I found this a really fantastic way to talk about my research in a language and a format that I had conversations through that I've never been able to reach with people before. And at the book launch that we had, I was asked to read an extract of my research, of the story. And I had people come up to me afterwards who were both nurses, and said, I felt very seen when I read your story, and that was very impactful to people that weren't healthcare and were really interested into what the underlying research was behind the story as well. I discovered I find writing dialogue incredibly difficult. It is not a strength of mine at all. I find writing about landscape and emotions and feelings far, far easier than I do about dialogue, but that was a new process for me. And I'm really keen to continue doing this and to help others continue to do these types of things, because I think communicating research in accessible formats is absolutely essential if we want research to have the impact and interest that we want from the public. I don't believe it should stay inside journals and in academic conferences alone. I think that it needs to be placed out in an accessible format to instigate and stimulate conversations and intrigue from the wider public and from inside the profession itself, whatever that may be. And someone's asked me to finish the story, to finish almost like the book of the story, which I'm contemplating. But I think these are really powerful tools, whether it's art, creative writing, yet to try dance and music. I have to say, there's two avenues I haven't quite seen if I can manage it. But for me, this was also a really therapeutic process for myself in terms of writing as well. And so just from a personal wellness aspect, I actually found this incredibly beneficial for myself. I'm going to stop talking there in terms of if anyone's got any questions, comments, etc. Emails, Twitter's, LinkedIn is where you can always find me. And I'm always happy to hear from people, have more discussions, do other presentations and things. So there we go.
Thank you. Thank you, Nicola. There's no questions in there, but I would like to say to everyone here, one of the aspirations for 2026 for the SIG is to create a book of the PhDs or projects that nurses and partners are doing in this field and turn them into a book of stories. Because let's face it, the Journal of Advanced Nursing and others aren't on our page yet, so we're going to create the pages ourselves. So working with Nottingham, we haven't got any funding for it, we haven't got anything to do it yet, but imagine by this time next year we'd created it so that your stories, your PhDs, your projects were created in a way that people just read them with joy and inclusion. That's my aspirations there. So Nicola, thank you. And this is why I also talk about the past and present nurse, because that's my story, the past, the absent and present nurse at the same time. So with that in mind, Kathy, thank you. Yes, this is the kind of energy we want. I'm going to move on to Marie. Is it Marie or Marie? I always say I'm Irish, so I urge to say Marie, but
it's Marie.
Marie, who is going to bring us another element of nursing and creativity back into the university space, but in a very different way to however I trained as a nurse or have ever educated anyone or assessed a master's degree. And just a word, Marie will be running the workshops at our summit in May, so to sort of whet your appetite. in this, being part of a book, getting tools for education. We're also going to be doing some hands-on stuff. So everything Marie says, you can do too, if you come, if we get the support for the summit. Okay, over to you.
Thank you so much, Marion. I'm just going to share a couple of slides. I hope you can see these okay, can you? Great.
Yes, we can see them, yeah.
Thank you. So great to be part of this. Thank you, Vicky and Marion, for inviting me. I am a children's nurse by background and had always used poetry in my own practice to help me kind of, as others have mentioned, in a cathartic way, to help me cope with difficult incidents. And I had a very inspiring talk in which I realised that actually maybe I could bring some of this poetry into my nurse education. So this is what I'm going to talk to you about. As with Marion and Vicky, this has been a long project for me. It's probably been about 15 years worth of work, really. So it's not happened overnight, but I'm very pleased with where we've got to with it. So some of this work is still happening at the University of Exeter. I'm now an honorary senior lecturer there and also working at the University of Plymouth as well. So many people have said to me, I'm not too sure why you're using arts with nurses. Don't they get enough education? Aren't they doing enough things? This is very much a complementary mechanism. Never have I ever said that nurses don't need other forms of education. But as I think Marion's articulated really well, I think our nurses need help with communication, with understanding other people's lived experience. And that's some of what we were trying to do by bringing in a different style of assessment, which I'll talk to you about. I think patients are very complicated. They obviously have holistic needs. And I also think there are a lot of historical and cultural perspectives that are quite hard now for educators to bring into teaching. So using arts was one way, which I thought actually was quite an interesting way to do it. But I hope many of you understand this perspective, don't believe that we should be just spoon feeding our students. I think our role as teachers is very much about showing them something and getting them to debate and understand it themselves from their perspective, which is what this helped to do. I also think that there is room for more community engagement in nurse education, more linking with charities and other partnerships, as Vicky's mentioned too. And I know the wonderful Kathy Rance on the call, who is one of my colleagues at Exeter, who's doing some fabulous work in that space as well. The other thing that we found with this module that we created is that a lot of our students have got talents, as mentioned previously, which you don't always know. So we had students who'd had a background in textiles or floristry, or actually were really accomplished painters and never ever mentioned it in 3 years of knowing them until this module happened. And then we were like, how have they not used these skills before? So I think it's actually trying to see students holistically as well, and all the things that they offer, not just in the way that they take a blood pressure or the way that they're able to draw blood. There are lots of challenges in nurse education. I won't go massively into these, but I'm very happy to share these slides afterwards. But I think one of the challenges I found is that a lot of our students don't have a lot of lived experience, and they do struggle to understand what is happening for the patients that they're caring for. And I think the arts offer this way of observing, of practicing their communication skills in a different way, and also kind of embracing empathy and this openness to others. I loved what Laura was saying about inclusion, because I think the arts are brilliant for showing that anyone can do anything, that people do express themselves in a very different way through art forms. And I think our student nurses can learn an awful lot about patient care and patient experience through the arts. The module that I created at the University of Exeter is called The Art and History of Nursing. The other thing I really wanted to do was to bring in the history of nursing, because I think it's something that we've lost a little bit through our curriculums throughout the years. But I do think it's really important that our students see what happened in the past so we don't make those mistakes again. And again, art is a really great way of seeing some of those things for themselves without us preaching to them, and them seeing actually some of the ways in which racism, sexism and other forms have actually affected nursing and been influential to our profession. I mentioned poetry. I can share some of the articles that we wrote. Basically, when I used poetry and then I took students to an art exhibition, they all said they wanted more, because they realised that this was another form of trying to understand themselves to understand their patients. So that's what we tried to offer at Exeter with this module, which is in their third year of study. And you'll see from the students, they seem to really enjoy it. The summative assessment was an art exhibition. They had to create a unique piece of art from scratch with a bit of help, I have to say. And it was all on certain themes. So we tried to choose some of the more difficult themes to talk about with our students, like spirituality, like end-of-life care, like racism, that are quite difficult to teach in a very didactic way, I think. So you'll see the students really enjoyed the peer learning. We tried to take a lot of approaches from arts education as well in terms of how they learn and how they developed their pieces. And we also had patient and public involvement members who were creating pieces alongside them to help them to see different ways of being there as well. We actually held a public art exhibition. We had over 100 attendees who came the first year, including lots of members of the public, and they really enjoyed communicating with our student nurses, as you can see from this picture here, and talking to them about their pieces. It was very interesting. One of our students the first year did a piece about abortion. Women's health was another prominent topic in the module. And I heard her reeling off all these stats, figures, all this, everything she'd read in order to create her piece. And afterwards she said to me, I didn't know I knew that. But it was just a very different way of learning and a very memorable way of learning, which they seemed to really enjoy. And as you can see, the community members who came really enjoyed it. And they actually gave our students an education on the day as well, because they talked to them and said, actually, my experience of endometriosis is quite different to that. And I want to tell you about that as well. So it was an extra add-on that I'd not really thought about beforehand. Oops, sorry. You can see our exhibitions here. So we've had 3 years of exhibitions that I've led on. The wonderful Victoria Sadler at the University of Exeter is continuing the module. And so there will be more on this website, but please do have a look. I've actually been offered a book contract where what we're hoping to do is use some of our students' reflections on other artists' work to build kind of knowledge. We had a really interesting encounter with one of our students who read the poem Tamoxifen, and I'm sure many of you have read that wonderful poem, but she actually wrote a response to that based on an oncology placement she'd had. We then had a really in-depth reflective discussion, and I thought, wow, this is a tremendous way of learning. So we're going to try and get some of our students, past and present, involved in that book with Victoria, and I'm hoping Kathy's going to join us too, to try and look at some of those different ways of teaching, learning and knowing, as Marion was saying. So please do get in touch with me. I'm happy to be part of this group and to help support Marion and Vicky with this really ambitious plan to bring more creative approaches to nursing. Thanks ever so much.
Thank you, Marie. Just seeing, I can't see any questions in there. So can I just say that we are such professionals. Look at this. We are bang on time with all of this that's going on. So now we have 15 minutes to start to imagine the future. And if you want to ask a question, do please put it in the chat now. What I want to do in proper nurse way is talk about our hands and talk about education and just use a simple way. And today I'm going to introduce the letter E, because everything that we've studied in creative health and use of the arts and nursing, philosophically, practically, educationally, engaging with communities, can come down to key words. The one that I sit here showing you as a sort of quite little bit anxious nurse on Zoom is embodiment. The arts bring us back to our body again. Our bodies somehow have disappeared, become absent in healthcare, whereas when we practice breathing with people or we work with our intuition, somehow we're embodying our selves again in nursing. And embodiment is that being present is part of how the arts help. We also talk about emancipation, because the arts have always been about social justice, raising what can't be seen in other ways, sharing what can't be said in other ways, just as Marie has been saying there. They've always been about education, not just pre or post education, but part of the whole plethora of education, whether it's practical, learning how to do art, or just being part of being human. And evaluation, you've seen that it's used in assessment within some nursing programs. There are many creative ways for undertaking evaluation that we do as well. And evolution, this is the future for nursing and nurses. I can't sit here after 40 years and say that an AI bot can replace what I have worked for 40 years to create, that human element. So we're going to work alongside those AI bots and actually embody what it is to be a human in a non-human health system. So it's more of a revolution than an evolution, because we're going to have to speak up a bit louder than the digital team. It's called dialogical, where we learn how to communicate. We're going to have to speak in different ways as well. So the special interest group is bringing together anybody who is needing to speak up in this way and bring their work to a wider audience, or try and translate their work into something that other people will listen to. We've had the Art of Nursing webinar since September 2024. I've just, the gender one, there's a health warning with it, was in November. The next one is January, and that's with Red Noses International and the Reading Agency, the launch of the Reading Year of Reading, how we work with young people. March has got Laura, new musical notes on nursing. I hope you see what I did there. April has Sophie Wallace, Lungs for Health, Michael Rosen and myself. And May, fingers crossed, if you all come with me and we create this story of presence and present nurses, we'll have a summit, a special interest group summit on the 28th and 29th of May at Kensington Palace. This will be a bringing together of your artwork, your experience, your expertise, and a way of bringing a band of us together to actually define what the future of nursing will be in this creative way. And the Friday will be workshops with Marie, where we're going to develop heads of nursing. Now, you might see heads of nursing in the media and in policies, usually a certain type of head. We want to develop a montage of heads of nursing, our heads, be it a stamp or a silhouette or some kind of way. So we develop a creative piece of art, plus the book of our work. Somehow start to get this information out and about, plus the toolkits for those who want to do education, plus a bit of well-being for ourselves, because as Laura said, when you start to do this, you bring the joy. And if I have to do another resilience conversation without any joy in it, I think I might just have to choke on my own profession. So let's bring this joy into the process that we're doing. So the SIG terms of reference are written, but they're just to keep us safe and sane. There's a map on the website. Please put yourself on the map. We won't police you. We won't put you on there. This is an interactive map. Put your project on there. Put your PhD on it. Put your person on it. Put your pin in that map so that other people can see you, see what you're doing, and then start to have a conversation with you. We also need some data to ensure that, because we don't have any funding for this, it's just a band of nurses and artists getting on with it. But there'll be a questionnaire for an evaluation at the end of this session in the chat that we will then start to use to develop us a bit further. So I'm going to stop there, 15 minutes. Are there any questions?
We do have a question. I'm just trying to see who wrote it. Mary Patterson. Do you want to come in, Mary? I can read out.
Oh, hi.
Go on, Mary.
Hang on, let me see if my video works. There you go. Yeah, my question is, I'm the head of arts for Royal Brompton and Harefield Hospitals, and we run a creative health programme across our sites. And one of the things that I do is talk to, I've obviously worked with a lot of nurses to make things happen. But I also regularly talk to nurses when they're undergoing their senior leadership development training. And I have an hour in this kind of very busy week that they have to talk to them about creative health and introduce the idea to them. Often they've never heard of it, and their lives are really, really busy and very pressurized. And I'm always looking for ways that I can speak to them, show them projects or ideas that will be really relevant to them, and to give them a way in. And I wondered if you just had any kind of ideas or tips on that.
Can I come in first? Because this is a passion of mine. Because when we started our creative health placement, we had quite a lot of challenges about educating our student nurses and our practice partners about why we were taking students out of a placement circuit and providing this learning opportunities. And it's taken this transition. And I think the nursing curriculum's at fault first and foremost in the standards, and Marie nodding as well. So we're both a lot of us on the same hymn sheet here, that we focus too much on the technical skills of nursing rather than those wider, softer skills. And I do think we need to take a cognizance of what the National Centre for Creative Health says about that it should be all healthcare professionals' education. So I think me as an educator, and that's the one thing I'm trying to do, is actually educate those beyond those who are qualified. But at Chester now we've had upwards of 1,200 students now go through this creative health placement. So we've got a massive learners who are working as registrants out in practice that hopefully will have an impact, and I'm measuring that now. But I think this is one of the things why I wanted this SIG to start, was that about how we can develop and develop knowledge. So recently been trying to work and I really like the idea of Nicola about getting out to those people, beyond the publications, because I've tried the Nursing Times and Nursing Standards as well as a sort of the wider things. So I think we've got a joint endeavour to do, is share this wider with our practice partners and colleagues, across the board. So that's my view. I'll shut up now.
Thank you. I can give you an example, because I taught leadership with the NHS Leadership Academy. Rewriting Frankenstein. When you're a senior leader and you've got governance issues and you're responsible for all kinds of things, so imagine rewriting Frankenstein now, and which one would you take to the GMC? The doctor or the if you took the doctor to the GMC, would they be done for malpractice? Now, if you rewrite Frankenstein for the use of AI, and suddenly you're getting people to actually quantify where responsibility sits when you're using AI algorithms, or where the humanity is, or even gender issues in leadership when there's a male protagonist trying to create life. Suddenly you get all these conversations that people didn't realise that were an issue for them, or a value or a belief that can't necessarily be explained in an IT protocol or our digital strategy or this, but you use a creative model to write a different kind of experience. It can be done in an hour, just as challenging people, but they'll come back to you. So come back to me with that one if you want. I've done it in general practice before AI existed, when we were talking about how to actually teach ethics. But this, and the other one I used was Thomas Hardy's poem called The Whitewashed Wall. You have to do a health warning with it, because it brings all kinds of experiences, but to connect with someone with actually what is health, what are we here for, and what is health in the context of someone's life, even if someone isn't there or something we can't see. That's the benefit of poetry, understanding those elements. So abstract doesn't work, emotion actually works. Call us in, we'll come. Any other questions? One thing I found students' wellbeing improves while doing their placement. We've done measures on activation and wellbeing, Warwick wellbeing. We're all nerds and doctorate people on here, so we can go on about your metrics and your methods beyond belief. But actually what we are really focusing on is the motivation to get involved, and that motivation is to be human and stay human in an ever evolving non-human health system. And if we don't do this, someone's going to tell us how to be creative. Social prescribing in some ways is already doing that. We need to be part of that. That's part of our work as well. So I'm Vicky, could you put the evaluation up, because I'm aware, because we're educators, people go, oh no, thank you, that's not for us. But actually also put in, there's 36, do this, but put a thumb up if you want to be part of the summit as well. If you are actually, it's London, it's Kensington, it'll cost you £25 to come, because that's what NCCH has to charge to do it, but that's it. That's it. Okay, we got 2, 3. My figure's 30. I need more than that. As you've, marvellous. Good, more, marvellous. And as you're filling in the form, let me tell you, as part of that, I'll be doing a tour of the palace and writing a tour called Queens and Vaccines, because we also need to look at the history of health and how health has happened through women when they didn't have influence. So if you didn't know how queens across the world have influenced smallpox and other vaccine elements, come, I'm writing the tour. I can take 20 people at a time round. It won't cost you anything because you're part of this group. So you get a benefit of engaging in stories about health as well and how other people have helped health. So, Ruth, please email me because you're in. We need you to be part of this. The date, I'm just signing the Memorandum of Understanding. Already there, we have HIV stories, we have monologues of the invisible skills of mental health nurses, and I'm trying to develop an Irish nurse story as well. If you've got other ideas, bring them in. Thank you.
So, Marion, just to end, we've got a question coming from Claire. She says, I'm a governor for an NHS trust and a National Centre for Creative Health champion. Who should I approach within the trust to get on board with this? So I think everybody and anybody would be my my advice.
Go to the chief nurse first, yes, because this is nursing first, and if they can't help, find a friendly Ned or the patient advocate.
Yeah, and there are such good pieces of work with hospital art and things like that. So within each NHS trust, there will be people practicing in creative health and sharing that. And there's so, if you look at the review that was published in 2017, which is on the National Centre for Creative Health website, there's really good examples from, dance for pain relief and music. There's so many good things that you'll be able to pick out and show those trust board members that have been there's a systematic review, and it shows that these are tried and tested. So there's a lot of evidence out there that we couldn't even possibly touch on today that will help you make those cases as well. But that's part of the SIG as well. This is what we want.
That's what. So if you tell us if you don't succeed, tell us your trust, and we'll find someone in there, because that's what nurses do. We know people, and we know people who know people who know stuff. We're the Malverns around the place. We're the glue in the system. We just need to now make ourselves visible glue instead of the invisible glue. So with that in mind, we've come to the end of our webinar. Do please sign up to the SIG. Do please put the date in the for the summit in your diary, and do please then put yourself on the map. And we're going to have another event in March. We want to set up podcasts, monthly podcasts, which will be for you and led by you. We're just trying to get the finances involved with that. But first step is that you are part of our group. You are a creative community for compassionate, human-centered nurses, and that's what we're here for. So thank you all for coming.